I want to bring in our medical expert now, Dr. David Winter from Baylor Scott & White Health. Good to see you today.
Good morning. Happy Friday to you, Sonia.
Thank you. So I'm curious your thoughts on this 3 feet versus 6 feet. You know, it's interesting. I was telling producers earlier this week that the World Health Organization has been saying 3 feet for a while now. The CDC a little bit different.
So the question is, Sonia, how far can the coronavirus fly? Well, it doesn't have wings. It's got to hitch right on these droplets. And how far do the droplets go? A lot of studies have been shown that 3 feet is about where they fall off for most people. A few little droplets go to 6 feet. Now, of course, if you're singing, shouting, coughing, sneezing, they go a long, long way. But here's the key. Those droplets are the vehicle to get to somebody else, to spread the disease. If you block those droplets with a mask, that's highly effective. So if you're wearing masks, particularly if two people are wearing masks, if I have one, you have one, we're not likely to spread the virus between the two of us. So shorter distances may well work, and they've been shown in some studies to be very effective.
Okay, that's helpful news. I want to stay sort of with the theme of kids, but children and vaccines. We've heard Moderna say, hey, we're going to start studying our vaccine in younger age groups. Can you sort of catch us up to speed with what's going on and what we know with regard to children and COVID vaccines?
Yes, there's no reason vaccines won't work for children. Children get lots of vaccines. The question is the dosage. How safe are they? They're probably very safe, but the dosage is the question. No completed studies yet. Studies ongoing. Now, we're told that by the fall, high school students should be able to get a vaccine, and by early 2020, younger children also. So vaccines are coming, and I suspect they'll work very well.
Dr. Winter, I had a teacher contact me because, as we know, in Texas, you know, teachers and educators are able to get the vaccine right now. But she had COVID several weeks back. Her symptoms and side effects after getting the vaccine were pretty severe into days 2 and 3. I'm wondering what we know about side effects if you've already had COVID-19 and then you get the vaccine maybe too soon, or what's the proper timeline?
Yeah, here's the issue. When you get the coronavirus, you get COVID-19, your immune system turns on antibodies, makes antibodies to fight and kill the virus, and they also hang around for a while, make sure it doesn't come back. Those antibodies are pretty significant in their concentration, typically for about 3 months. Then they wane off some. So during those first 3 months, if you get a vaccine, the antibodies think, well, that's a viral-like particle, and they attack it, at least for some people. Fortunately, the symptoms don't last very long. They do go away. But the sooner you get the vaccine after COVID, the more likely you are to have higher symptoms, more significant symptoms.
So I want to talk also about long haulers. I had a woman contact me and say, Sonia, I had COVID in January. I still do not have, as of today, my sense of taste and smell. What can I do to bring it back? Is there anything she can do, or are there treatments for long haulers?
Yeah, long hauler syndrome occurs when people get COVID-19 and their symptoms last months and months and months. Typical symptoms are fatigue, you don't sleep very well, this condition called brain fog, muscle aches, loss of taste and smell. Now, we don't actually know what the cause of that is, but a recent study suggested many folks, not all of them, but many folks got a COVID vaccine and the symptoms went away. So I'm not sure if that's going to work or not, but it's certainly something worth trying.
You know, I read that actually this morning as well. I also read that these people should maybe consider participating in clinical trials. How do we connect them with those?
Yeah, that's a good question. I don't know the answer to that, but those trials are starting to come out. We'll try to get that information out to you later, because right now we need some studies. We don't know exactly what causes long hauler syndrome nor exactly how to treat it. So we need some studies, Sonia. We'll try to get those out to people later.
And one last question for you, Dr. Winter. You know, herd immunity. When is this going to happen? People keep asking me, Sonia, when is this all going to end? When are we going to go back to normal? And I think it really comes down to herd immunity. Is that something that we could see in the next months to a year?
Well, I hope so. Herd immunity is that ideal state where the virus goes away because enough people are immune to it. You become immune to it by having had the virus, being exposed to it, or getting a vaccine, either way. And we hear various reports, we need to have 60% of the population or 85% of the population. We don't really know. Some scientists actually are saying we're not sure if it's ever going to go away completely. We may need repeated booster vaccines from here on out. It may become as common as a cold or influenza. Hope not, but right now we don't actually know about this herd immunity, how well it's going to work. or if it's going to work actually at all.
Yeah, living through the evolution of science. Dr. David Winter, thank you so much for your time today.
Thank you.